Complex continuing care is a slow stream rehab. Patients tend to be a little bit more medically complex than what you would see maybe on the rehab unit. They typically have more than one diagnosis that they're dealing with that's preventing them from going home. The Southwest LHIN looked at the complex continuing care beds across the LHIN and realigned the beds so that the North would have the 10 CCC beds here. The impact to the patient care is that they don't have to go out of the area to access complex continuing care. The feedback from the patient and families is very positive. Many of them say that they wouldn't have been where they are without the program, and they would not be going home. Certainly many of them were told that they weren't going to be as high functioning as when they've left our unit, and that's really a tribute to the physicians and the staff here at Wyerton.
My name's Sherry Lalonde. I was trigged, had abdominal leakage and suction, damaged vocal cords, and was fed by tube only, and was told that I would never walk, never get off the tube feeding, and always have a trach for the rest of my life. In January, they got me on food. The great girls and guys in physical rehab got me walking. They were able to take out the trach and me live without it. And I'm now back home, taking care of myself, driving a car and walking wherever I want to go. I've never been in a place like this, but if I have to be in one, this is the best there is. Absolutely the best. The staff here are amazing.
So we had a whiteboard with magnets that depicted the patient's therapy sessions. The therapist would gather at the whiteboard, pick out their appointment times for the day, and we wanted to create an electronic version of the board to create some ease of use for the staff, and also to allow the patients to be able to read their appointment schedule.
Basically, they asked me to come over. I took a picture of the board that they had, and I used that as the beginning for the design. Once the time was actually set aside to do it, it really only took 3 or 4 weeks to do the programming, which was very nice. We did come back a couple of times and talk to the clinicians to make sure that we were on the right track and we were giving them what they wanted. We walked into meetings and said, give me your wish list and I'll do what I can, and I think we pretty much hit everything they asked for.
The tracking board allows us to be able to set those appointments from anywhere in our GBHS. So we have allied staff that work in other areas such as Wyerton, other areas of the hospital. So they don't have to be right here on site, and they have access to the board and can make appointments that work both for the patient schedule, nursing schedule. So it's a win-win for both our patients and our allied health.
We started with the rehab board. We then expanded that into allowing other pieces of information that reside within our electronic medical record to be extracted as well, such as orders. In our DI area, for example, we use this tracking board for showing an order that has been started, whether it be an X-ray, where it is in the process, when it's completed. That's dovetailed into the orthopedic tracking board, which allows the ortho tech to be able to see at a glance whether they have a patient that's arrived at the hospital, checked into central registration, is over having an X-ray, or will actually be in their waiting room, so that they can standardize patient flow, they can make it more efficient, they can process patients that are kind of out of order, but use patient time more efficiently. So we don't have a backup of the waiting rooms, and we don't have people out in the hallways anymore backing up our flow.
We are very proud to have received this designation. We're the fourth hospital in the province of Ontario. It took us about 3.5 years. It's a lot of work. We follow the 10 steps of success to becoming baby friendly, set out by the World Health Organization and UNESCO, and it's not an easy thing to do. It requires a complete change in culture of the staff, and my staff have worked very, very hard to accomplish this.
Baby friendly means that we organize our care based on evidence-based practices and centered around mom and baby and promote breastfeeding.
If mums breastfeed for 2 years and beyond, it decreases their risks of many things like chest infections, ear infections, obesity, diabetes, and gastrointestinal infections.
The old way that we did things was very nurse-centered and physician-centered. And the new way we do things is very baby and mom-centered. We used to take babies away as soon as they were born, dry them off, do all the assessments and things that we wanted to do with them. And now we do what the babies want to do, which is be skin to skin with mom and be at the breast. And even though it seems like the new way would be harder, once you get used to it, it's actually easier because babies do better, breastfeeding is easier, and moms have a better experience.
We've actually decreased the admission rate to the intensive care nursery by about 20% because the babies are going skin to skin right after a C-section. They used to end up coming out from the section and having to go into the intensive care nursery, and now they're not. They're staying with their mom and dad. We belong to a network called the Maternal Newborn Child and Youth Network in southwestern Ontario, and there's about 45 hospitals, I believe, in that network, and we're the first of the group to have received our designation. Everyone is working towards it. The Canadian Pediatric Society has encouraged hospitals to work towards baby friendly, and so we've all started the road, but some are much further ahead than others, and we were just very fortunate to sort of get through the gate first.